limitations, and it's this the trick I'm telling you. That's the trick to make a diagnosis.
So what I'm hearing you say is that the term pseudo seizure is not one that you shared with Dr. Sujan. He made that diagnosis based on his own criteria, correct?
Based upon his own knowledge that he might have, which I might not have. I'm certainly not saying that this is a wrong diagnosis, but certainly he has some information that possibly I do not have.
I can tell you why, sir, may I tell you why he thought it was not a seizure, and you can tell me if you think that sounds correct. He said because it did not accompany a loss of bladder control or a loss of bowel control or a tongue biting of any kind. Therefore, he did not believe that this was a true seizure. Is that true?
Look, this is if the only thing I will answer this question only based upon your description. Dr. Sujan did not tell it to me. He did not make this statement in front of me. But for the sake of this discussion, I am assuming that whatever you are communicating to me is true and you was provided this information. So based upon this assumption, that's not true.
Okay.
There are seizures in which you do not have this bowel or bladder control or tongue biting. In fact, this is not a criteria to distinguish between seizure and pseudo seizure. There is criteria, but fortunately, it is not that simple. You have to have a little bit more than that. This is why, in order for you to look at the red flag, a neurologist has to look at the spell. Of course, a neurologist cannot come and move with her and keep an eye on her so that she has the spell. So the best practical way is that whoever she lives with or whatever, a family member has this idea that once she starts having those spells, instead of just panicking it out, they know what to do, record it.
Okay, so at this point you would recommend that she continue the seizure medication, and that you would recommend that she see a neurologist.
As an outpatient, absolutely. This is my recommendation. I just dictated a note also.
How do we get that recommendation so that we can show that to her primary care doctor and get her the appointment to see a neurologist? Can we get that recommendation from you in writing?
No, yes, yeah. But not from me.
Oh.
This is how it will be done. When you see the patient in the hospital, you dictate everything. You document everything, including what I just told you, my position on that. Okay? This is a part of the medical record. When she will be discharged, you cannot get the medical record now when the patient is in the hospital.
You cannot get the medical record now when she's in the hospital.
No. When the patient will be discharged, you need to wait 3, 4 days or 5 days, whatever. Then you will call the medical record of Corona Regional Medical Center. You will give your mother medical record number, name, date of birth. If medical records are in the medical record, are they ready to be picked up? They will say yes, no, whatever. Sometimes they charge, and they can legally charge you to make the copies.
Okay.
Then you will ask them that what part of medical record you need. You need entire medical record, or you need just neurological consultation, you just need primary care consultation, things like that. Okay. So you possibly will be better off getting the doctor's notes, initial follow-up, and the workup which was done. Do not get nursing notes. They do not have much value outside the hospital. Okay. So, and then you take that documents and that medical record copies to your primary care physician, and then that will have in writing, and he will use those medical records to submit the authorization to the insurance.
Okay, one more question. The MRI showed the possibility of a mini stroke in the past. Okay. Would that have been related in any kind? Could that lesion have, I don't know if you saw the MRI, would that have been related?
It is a subcortical lesion. I remember that. It's a subcortical lesion. Okay, no, that might not be responsible for seizures, yes.
That might not be responsible from a seizure?
Yeah, because it's a subcortical stroke.
Okay.
Please do not ask me what is a subcortical stroke.
No, it's okay. I don't need you to explain that. But I'm concerned about another stroke happening.
Another stroke happening, is it a concern? Yes. Is there anything to prevent it completely? No. What is the single most important thing to prevent it? High blood pressure control.
Okay. And she's on blood pressure medication. Okay, and one last question. In the past, it's been some of her doctors have proposed the fact that she might have Alzheimer's. Would the EEG, would not show any evidence of that, correct?
The way to diagnose Alzheimer's are two. Clinical examination and history, which is the preferred way to do it. second way to do it is PET scanning, which nobody covers it. If you want to have a test, then it costs $3,000 as an outpatient. EEG is not diagnostic.
Tell me the first way you said to diagnose Alzheimer's?
It's a clinical history and examination.
Clinical history and examination by a neurologist.
Yeah.
Okay. And the fact that she's on all these medications, would that complicate the diagnosis at this time? Or would a doctor, outpatient doctor, neurologist be able to diagnose her with Alzheimer's even though she takes all these medications?
Yes and no. It's more, this answer is more complicated than yes and no.
I understand. So, okay. My question is, does she have to be off of all those medications to get an accurate diagnosis of Alzheimer's?
I do not know. We are talking about something which is not a question here.
Okay.
Ma'am, I need to go. Okay?
Thank you very much.